The achievements of American agriculture are truly remarkable. An ordinary supermarket probably stocks between 15 and 50,000 different products. The produce section can contain 100 different kinds of fruits and vegetables, and the prices that Americans pay for their food is really very reasonable. A typical family in the United States spends less than 15% of its disposable income on food produced by American agriculture. New technologies are increasing every day. These new technologies promise to grow more food using fewer chemicals and less water, land, energy, labor, and capital, and causing less damage to the environment. The question that we ponder in NIOSH is whether or not this profile of positivity, of promise, of plenty, can be translated into the currency of agricultural safety and health, injury and illness to those that labor in the fields to produce the products that we consume. Thank you very much for inviting me here this morning, and congratulations to all of you who took time out of your busy schedules to discuss the important issues of agricultural safety and health. I remember when, Bill reminds me, when ASHCA was established 6 years ago, and now to see it blossom like this, thrive, is just a wonderful thing, and we in NIOSH thank you for including us in the group of folks who you consider to be partners of yours. We're very proud to be an ASHCA partner and join with ASHCA in the stated mission of, quote, proactively addressing ongoing and emerging occupational safety and health issues affecting U.S. agriculture, unquote. NIOSH is especially aware that ensuring the health and safety of agricultural workers, whether native or foreign-born, men or women or young adults or children, is a challenge on so many levels. And there's no doubt that agricultural safety and health is ASHCA's primary challenge for all of its members, whether they're agricultural producers, agribusiness owners, operators, insurers, farm workers, academics, advocates, health professionals, labor advocates, safety and health practitioners, physicians, nurses. We're proud to join them, and we consider NIOSH to be in that group of ASHCA advocates. The Congress appropriates to the National Institute for Occupational Safety and Health taxpayer funds to operate 10 agricultural safety and health centers throughout the United States. And we're very proud of the work that those centers do. But our work in agricultural safety and health, both NIOSH as well as its centers, as well as ASHCA's, I think needs to be evaluated by the numbers. The return on the taxpayer investment needs to be looked at all times. On August 22nd, 2013, the Bureau of Labor Statistics in the Department of Labor released its 2012 Census of Fatal Occupational Injuries. Agriculture, forestry, and fishing fatalities decreased 16% to 475 in 2012 from 566 in 2011. This follows a 9% drop in agricultural fatalities in 2011. Fatal injuries in the crop production, animal production, forestry, logging, and fishing sectors were all lower in 2012. However, let's not pat ourselves on the back quite yet. despite the declines in the number of fatal work injuries in this sector over the last 2 years, agriculture recorded the highest fatal injury rate of any industry sector at 21.2 fatal injuries per 100,000 full-time agricultural workers in 2012. Being a fatal injury industry leader among all industries in the United States is not success by any means. This rate means that for agricultural workers, the risk of fatal injury is highest in agricultural, forestry, and fishing. Clearly, we have more work to do if we are to change that return on the taxpayer investment. But a lot of attention is being focused by all of us on doing exactly that. And the issues of agricultural safety and health have been in the news more this year than last year. Investigative reporters have delved into the unsafe working conditions that agricultural workers face. The Oregonian newspaper's Anthony Schick addressed child farm labor, reporting that it's much more widespread than our statistics indicate, and that agricultural work can be especially hazardous to young children. Two investigators, one from the New York Times, John Broder, the other from NPR's Howard Burks and the Center for Public Integrity's Jim Morris, focused on one of agricultural's deadliest hazards, grain bin and silos. The Center for Public Integrity, NPR analysis of OSHA data on 178 grain entrapments from all the way from 1994 to the present was not a positive report for those of us who want to prevent such accidents and injuries. Farm Worker Justice released a report on how current U.S. pesticide use endangers farm workers. In addition to these print media stories, the migrant agricultural workforce has received prominent attention in the Congress. The Senate passed an immigration reform bill and included legal status options for current undocumented workers and a worker visa system with penalties for employers with willful health and safety violations. Attention has also been drawn by the print media to the U.S. Department of Agriculture's proposed poultry and hog rules about slaughterhouses, the increase of speed production, food safety, and fecal contamination of carcasses, et cetera. The General Accountability Office issued a report that suggested that USDA needed to do more work in this area. Did not mention workers, but criticized USDA because they didn't use a science basis for the establishment of their pilot program. And this is an important point because USDA, like the rest of us, have to use scientific principles in order to solve the problems that are in front of us. NIOSH certainly wants to be a partner to all the members of Ashland, to all of you that are here today, because our goals are the same. We want the agricultural workforce to be the safest and to be the healthiest in the world. And in addition to funding agricultural research at the 10 centers, the place of agricultural safety and health at NIOSH has been elevated. A couple years ago, we established an Office of Agricultural Safety and Health within the Office of the Director at NIOSH. Captain Brad Husberg, who's here today attending the conference, is the director of that office. We have specialists who are working with Brad. Pietra Cech, who is attending the conference today, is also one of those people. We are trying to coordinate strategically all of the extramural activities that go on within the centers and our intramural activities. We've recently, at least in the last 2 years, have moved much of funding that was in the intramural program inside the walls of NIOSH to the extramural centers. We feel that that is a better way to utilize the money to get a better return on the taxpayer investment. Certainly, providing new funding for 2 new extramural centers is a part of that. The new Upper Midwest Center here in Minneapolis and the Central States Center in Omaha. We believe that the transfer of these funds from our intramural research program to extramural partners increases the ability to address regional and local agricultural issues, because oftentimes American agriculture from a national perspective, if that's the only dimension that one looks at it, you lose the regional issues. So we are only retaining within NIOSH those activities that we consider to be inherently governmental. And one of those activities, and the prime activity that we consider to be inherently governmental, is the funding of large national surveillance surveys, which we feel is appropriate for NIOSH to do, but other activities we want to see our extramural partners do it. At the same time, we're certainly still devoted to independent evaluation of NIOSH and the work that its centers do. Measuring the relevance of the work that we do and the impact that it has on the lives of agricultural workers is preeminent. We spend a significant portion of the taxpayer appropriation that we're given to show impact. And we were recently buoyed by a favorable evaluation from Dr. Gunderson's group, who looked at our agricultural safety and health program for the second time and found it to be doing a good job, and it needed to do even a better one, and they offered ways that we could improve our program, and we are busily trying to improve it together with our partners. We certainly in NIOSH want to be in the position to explore safety and health, all of the implications of agricultural safety and health, to a host of emerging technologies that I'm sure that you're talking about at this conference. Certainly agricultural mechanization, advanced robotics that are being used in many agricultural areas, plant genetics, other technologies. The food and fiber industry is producing, from a scientific standpoint, remarkably revolutionary changes in the agricultural workplace. And since the agricultural workplace is populated primarily by workers, our interests are piqued in all of these technologies. We certainly want to improve worker education. We want to improve ways to increase communication with workers. And indeed, the challenges in that area, as you all know, are significant, not only in terms of language and education, but also in terms of new methods that we could employ to reach workforces. We certainly are really interested in some of these new technologies, and we're thrilled, for instance, by the University of Missouri that has a tractor rollover prevention app for handheld devices. I tried it out, and I was really impressed by one aspect of it, that the app automatically calls for help after a tractor rollover accident. It's really remarkable what technology can do for us in this area. Lastly, I wanted to thank those who work so very hard to protect children in agriculture, to take care of them in every way, their education, their health, their safety. Thank all of you that work in this area. It's a very difficult area, a complex area, and I want to especially thank and acknowledge the National Children's Center for Rural and Agricultural Health and Safety at the Marshfield Clinic, one of our longtime partners, for their leadership in the field of childhood agricultural safety and health, and also for their work at this conference. I'd also like to acknowledge the work of the Childhood Agricultural Safety and Health Network, and especially their blueprint for protecting children in agriculture, the 2012 National Action Plan, which makes, I think, all of us look long and hard at new ways to protect childhood agricultural workers and to prevent injury and illness in this population. In closing, let me again say that NIOSH is very proud to have stood with Ashka at the beginning, and now that it's reaching young childhood status at 6 years old. And we're just thrilled by seeing so many of you here at this conference. It makes our work behind the scenes as funders just really a thrilling exhibit of our impact. So despite the many safety and health challenges that we all face, we are together, industry, labor, advocacy, academics, practitioners, and the government are together to make the agricultural workforce the safest and the healthiest in the world. Thank you very much. Have a wonderful conference.